Bismillahirrahmanirrahim. My name is Muhammad Atif Khan, and today I am here to present my PPT about abdominal examination. And I am here with my colleague Dr. Rehman Sabir and a patient with Dr. Saad. And these are my group members. First of all, we will do general examination and then we will do abdominal examination. In general examination, we will do general inspection of hands, arms, face, eyes, mouth and neck. Then we will do about abdominal examination, inspection, palpation, percussion and auscultation. In general examination, we will look nutritional state, pallor, jaundice, pigmentation, and mental state. We will look hands. In hands, we will look nails, clubbing, cholonexia, leukonexia, pallor erythema, dupuytren contracture, hepatic flap. In pallor erythema, we will look hands look like this, and in dupuytren contracture, hands look like this. Arms. In arms, we will look spider nevi, bruising, wasting, and scratch mark. Face and eyes. In face and eyes, we will look conjunctival pallor, sclera, jaundice, iritis, cornea, and parotid enlargement. Here we can see parotid enlargement and xanthelasma. And when we see about mouth, we will smell, breathe, and we will see lips, gums, and tongue. In lips, angular stomatitis, cheilitis, ulceration, and about gums, gingivitis, bleeding. About tongue, atrophic glossitis, we can see strawberry tongue. Neck and chest. In neck and chest, we will see about cervical lymphadenopathy, left supraclavicular fossa, gynecomastia, loss of hair. Now, I would like to invite Dr. Rehman to examine the patient.
Assalamu alaikum. My name is Dr. Noman Shahid. I'm a 5th year medical student and I'm here to examine you. I hope you will cooperate. So, should we start?
Yes, of course.
So, sir, what is your name?
My name is Saad.
So, what's your age?
My age is 23.
Are you married?
No, I'm single.
So, sir, can you know about your height?
Yeah, it's 176 centimeter.
176 centimeter. So, what about your weight?
Weight is 78.
Sir, is there any decrease or increase in your weight in recent days?
No, there is no change.
Okay. So, what about your waist?
Oh, waist, I didn't make
You
it.
don't know. So, do you calculate your BMI?
No.
No. Okay. So, sir, can you please show me your nails? So, in the nails, we should go to look for cholonexia and leukonexia. So, sir, can you please turn your hands? So, after that, we should go to look at the patient's palms. If there is any redness in the palms, it may be a case of chronic liver disease, and in females, it is also common in pregnancy. So, after that, we should go to look for the fingers of the patients. If there is any clubbing present or not. Clubbing is also a sign of chronic liver disease, and it may be also due to other diseases like inflammatory bowel disease and malabsorption. So, sir, can you please place your hands in front like this? Extend your hands. Extend like this. Okay. So, if in this we should go to see for the flapping tremors, which will be in the chronic liver disease. We will see in chronic liver disease. Okay, sir. So, okay. So after that, we should go to look at the chest. So can you see your chest?
Yeah.
Upper chest. After that, we should go to look at the chest of the patient for the involvement of the cervical lymph nodes. If there is any swelling of the cervical lymph node, it may be due to some metastatic disease from liver or from else. So, okay, sir. After that, we also go to look at the patient parotid gland to see the swelling, which may be due to chronic alcoholism. Okay, sir. Thank you. So after that, at the patient's face, we should go to look for the spider nevi. Also, in the eyes, we should go to look for the jaundice, for pallor. So can you please look up and down? Okay. So sir, can you please open your mouth for me? So in the mouth, we should go to look for angular stomatitis. And can you please take your tongue out? Yes. And we also going to look at the tongue for any affected tongue affected by iron deficiency or due to folate deficiency. Okay.
Next, now we are discussing about abdominal examination. First of all, we discuss about positioning. Abdomen can be divided into 4 quadrants. Patient should be lying on spine position. In abdominal examination, we should first we discuss about inspection. Inspection, we will see shape, movement of abdomen, any scar on the abdomen, distension, striae, pigmentation. After inspection, we will palpate the abdomen. In palpation, we ensure that your hand will warm. Stand on the right side of patient. Help to position the patient. Ask whether the patient feel any pain before you start. Begin with superficial examination. Move in systemic manner through the abdominal quadrants. Repeat palpation deeply. Tenderness, discomfort and resistance to palpation, involuntary gardening, reflex contraction of the abdomen muscles, rebound tenderness. Patient feel pain when the hand is released. Tenderness plus rigidity. Perforated viscous, palpable mass, impalpable aortic pulsation. Abdominal examination. Murphy sign is important. Pain in right upper quadrant, inflammation of gallbladder, Courvoisier's law. Blumberg sign is also important in abdominal examination. Rebound tenderness, pain upon removal of pressure rather than application of pressure to the abdomen. Peritonitis and appendicitis is important in abdominal examination. One third anterior superior iliac spine to umbilicus. Location of AV in retrocecal position. Deep tenderness. Fluid thrill. In abdominal examination, fluid thrill is also important. In fluid thrill, place the palm of your left hand against the left side of the abdomen. Flick a finger against the right side of the abdomen. Ask the patient to put the edge of hand on the midline of the abdomen. If a ripple is felt upon flicking, we call it fluid thrill. Palpation of the liver. Palpation of the liver. Start palpating in the right iliac fossa. Ask the patient to take a deep breath. Move your hand progressively further upon the abdomen. Try to feel the liver edge. Palpation of the spleen is also important in abdominal examination. Roll the patient towards you. Palpate with your left hand while using left hand to press forward on the patient's lower ribs from behind. Feel along the costal margin. Next step is percussion in abdominal examination. Solid or fluid filled structures produce dull sound. Structure containing air and gas produce resonant sound. At the end, we will do auscultation of abdominal examination. Place the diaphragm of the stethoscope to the right of the umbilicus. Bowel sound are caused by peristaltic movement. Sound is occur every 5 to 10 seconds. Absence of bowel sound, paralytic ileus or peritonitis. Bruit over aorta and renal artery could be a sign of an aneurysm and stenosis. Now I would like to invite Dr. Rehman do abdominal examination.
So we are going to start abdominal examination of our patient. So sir, please lie flat on your back. Like this, yes. And can you remove your? Yeah. Here. Yes, it's okay. Okay. So first of all, we ask the patient to lie flat and place his arms aside, and in that we expose the patient from the xiphoid sternum till the pubic symphysis. So after that, we are going to feel every region of the abdomen gently. So sir, please tell me if you feel sore, please tell me. So after superficial palpation, we should go for the deeper palpation, and after while doing this, we also look at the patient face if there is any discomfort in the patient face. So sir. So after that, we should go to palpate the liver of the patient, and while we should start from the right iliac fossa and then go up 1 centimeter up for the liver. And while doing this, we ask the patient to take deep breath in and out, because in deep breath the liver descends in the deep inspiration. Okay. Yes. So now we are going to do the physical examination of the patient. At first, we come and inspect the patient, and in inspection, we should go for to look for the scar or any there is any other trauma or anything, and we ask the patient to see the abdomen from the C1 sternum till the pubic symphysis, and after inspection, we should go to auscultate for any bruits, for the renal bruits, for the aortic bruits, and we auscultate on the liver, also on the kidneys for the renal artery stenosis, and we are also going to listen the bowel sounds. There should be a bowel sound in every 5 seconds, and if it is not present, we should have to wait for 2 minutes. Okay. So after that, we are going to examine each quadrant of the patient's abdomen, and I'm just going for this we should have to keep our hands warm and then we start in every quadrant of the abdomen, and we're doing in the patient's abdomen like this. And while doing this, we should have to look at the patient's, and while doing this, we should have to look at the patient's face if there is any sign of discomfort in the patient's face. So after doing this, we should go to palpate the liver of the patient. For palpating the liver of the patient, we should start first from the right iliac fossa, and then we go 1 centimeter above from right iliac fossa. And while doing this, we ask the patient to take deep breaths. So sir, can you please? Yes. In deep inspiration, the liver descends, and we can feel it. Yes. So we do this for the lower border of the liver, and for the upper border we start from the fifth intercostal space and we percuss, and where there is dullness, the liver is there. So that's the size of the liver. And also we go for the spleen in the same manner. We start from the right iliac fossa, go on the umbilical fossa, umbilical region, and then go into left hypochondrium. And if we do not feel it like that way, we ask the patient to turn it on the other side, and then we place our hand at the back side and then feel it. So can you please turn on my side? Yes, like that. Yes. And while do this, we also follow the same pattern from the umbilical. Go toward the left hypochondrium. Okay. Okay. Flat. So after spleen, we are going to go for the kidney, and for the kidney, we should place our one hand at the lower border of the ribs, and then from the with the other hand, we feel the enlargement of the kidney, and then we also perform it on the other side in the same way. Okay. After that, we are going to palpate aorta with our both hands, one hand on the spleen and the other hand on the liver edge. We should compress it and see if there is any pulsating mass. It may be due to aortic aneurysm. Okay. So after that, we are going to look for the bladder, for the upper border of the bladder. We start from the umbilicus and we go down and we percuss here. And when there is no resonant sign and there is dullness, this is the upper border of the bladder. Here. And after that, we are going to look for the ascites in the patient. For ascites, we ask the patient to put one hand in the center like this. Yes. And here we are going to feel the thrill in the patient's abdomen. And for the thrill, we do this and wait for 5 seconds. If there is any fluid movement or thrill present, and then it may be a case of ascites. So it's okay. So at the end, after auscultation, palpation, and percussion of the abdomen and inspection, sir, please sit down. So my patient name is Dr. Saad, and he is 24-year old. So my patient name is Dr. Saad Ahmed. He is 24-year-old, and we just go to look at his GA system, and he is perfectly all right. His organs and and while inspection, oscillation, everything is normal. Thank you.